HERS color test, and
No.
its use is for
Complete name. You want to give it a try because there is time.
uses for to rule out color blindness.
Only precise answers accepted. Complete name. Pass. Excellent. Pseudo isochromatic is a very important part of the name. Use specific. What color vision? Excellent. Full marks to team number 5. Okay. Next question again to team 5. Label the red arrow. Sorry, forgot to put the timer. Lane of vision. That is incorrect. Passing on to the next team. Excellent. Panem's fusional area is the correct answer. Full marks to team 6. Okay, next question to team 7. Sorry, team 6. So sorry. 4 triangle DBO. Expand or tell the full form. Pass. 7, team number 7. 4 triangle DBO. No negative marking. You can just give it a try. There's no negative marking. Team number 1.
Astigmatism of the left eye with
Full form. What is the triangle? What is the D? What is the B? Team number 2. All right. 3, 5. All right. Should we pass? Audience, anybody? There are prizes for the audience, just in case you were wondering. No attempts at all? All right. 4 prism diopters base out. Okay. Next question, team 7. Okay, that question was for team 6. Next question, team 7. Which bone does not form the medial wall of orbit? A. Maxillary, B. lacrimal, C. ethmoid, D. frontal.
D frontal.
That is correct. Full points. Team number 1. 5.5, 6.5, 6.9, 7.7. What do these numbers signify in ophthalmology?
It's the distance of the extraocular muscles, miles. M for medial rectus 5.5. The distance is 5.5. Then
It is the what for the muscles?
insertion of the muscle.
Insertion for the muscles. That is correct. So what are these numbers? Insertion from the muscles?
From the limbus.
From the limbus, yes. Perfect. Full points for team number 1. Next question, team 2. Which area of the occipital cortex is responsible for visuosensory function that receives the fibers from optic radiation? A. 17, B. area 18, C. area 19, D. area 21. Team number 2. Area 17 is correct. Full points to team number 2. Last question, team number 3. Name the blood supply of the macula. Ma'am, only one is left. Okay. Since we have Kanachur Medical College joining us, we'll give them one question, one attempt. Okay. This one last question is for you. Team number 4. Name the blood supply of the macula and name one disease of the retina that highlights this blood supply.
Central retinal artery.
Blood supply of the macula. That is incorrect. Passing on to team number 3, then it will come to 5 because it was their chance first. Yeah.
Disease of the retina is CRAO.
Blood supply of macula.
Short ciliary artery.
Ciliary, choroidal circulation. Okay, fine. Full points to team number 3. Okay. This brings us to the end of the first round. Everyone has performed really, really well. I think I should have prepared better questions. Can we have the scores, please?
Okay, one second. Till the scores are coming up, just a request to the participants to please hold your mic very close because you're not very audible behind, okay? Everyone. And the audience needs to be more cheerful. We need you to clap for everybody, okay? Not for me. When they answer, okay? Please be a very encouraging audience and encourage everybody, all right? Yeah, with this I hand over the mic for the scores.
At the end of first round, Father Muller's score is 30 points. KVG 40 points. AJ 20 points. Kanachur yet to score. KMC Manipal 40. Yenepoya 30 points. And KMC Mangalore 40 points.
All right. So everyone is basically going head to head. Let's go on to the next round. Okay. So a lot of the eye diseases that we know are generally asymptomatic or at least start out asymptomatically. But when you look at the eye is always telling you a story. You will see a dot here or a line there or a spot somewhere and you will know what has happened to the eye. This round is all about those little subtle signs that you need to identify and tell where it is seen. Okay? So let's begin with the shape of you. These are the basic rules. There are total 21 questions and the questions are about clinical signs. There are two parts of the questions, please listen carefully. There are two parts of the question. There is plus 10 for each part and minus 5 for each part. So the maximum you can score is plus 20. The maximum you can lose is minus 10. Okay? 15 seconds per question and this is an elimination round. Only the top 5 teams will be able to move to the next round. The total of the round 1 and 2, we'll calculate that and decide. This round also can be passed. Okay. So we ended with 5. We ended with 4. We'll begin with 5 this time. Okay? Ready? Everyone can see the screen clearly? Alright, let's begin. We are starting with team number 5. Okay, because we ended with 4. All right. Identify the shape. Where is it seen? Time up. Team number 6. Pass. Team 7. Okay. Team 1. Team number 2. One part right answer is plus 10. Yes, negative counted. All passing are the same marks. Plus 10, minus 5. Yes, both are the questions. Alright. Count this as an example because nobody is answering. I'll let you know the answer so you'll get the hang of it. Okay? Team number 3. Anybody? No, this is not an example. It's an actual question. This is the shape we're talking about. Team number 4. Audience. KF ring. Thank you. Where is it seen? Where is it seen? Whoever answered KF ring, where is it seen? Excellent. Full points for whoever answered that. Please give them a gift. Smaller. No, this was a simple question. Small gift. All right, now that you know what we're talking about shapes. Okay, so you have to identify shapes in the eye. Next question, team 6. Identify the shape. Where is it seen? Okay. Team number 7. Give it a try.
This is Elchnick spots seen in posterior capsular opacification.
Excellent, excellent. Full points to team number 7. Question number 3, team number 7. Identify the shape. Where is it seen?
Washer's ring seen in blunt trauma of the eye.
Perfect. Team number 1, next question. Identify the shape. Where is it seen? Pass. 2. Team number 2. Give it a try. Sorry? You're not audible. I'm sorry. Can you hold the mic, please?
Negative is there, no, for the even
Negative
for the pass.
is there. It's minus 5. Okay, team number 3. No? 4. 4, you really need to give it a try.
Vitreous detachment.
Yes. Seen in vitreous detachment. Name, identify the shape. What is it called?
Single.
Sorry?
No.
Alright. We will give plus 10 to team number 4. Identify the shape, one part of the question, to team 5. Horseshoe. That is incorrect. Audience, shape. Vice ring. Excellent. Okay, everybody has collectively answered. Don't know whom to give the prize. Okay. Where were we? You were on 7, right? Oh no, 1. Okay. So team number 2, next question. Identify the shape. Where is it seen?
Lucid interval of work to see that arcus senilis.
Okay. Arcus senilis seen in? Seen in?
Old age.
Old. Yeah. Correct. All right. Full points to team 2. Team number 3. Identify the shape. Name one use. You can answer at least one part of the question. No? Okay, time is up. Team number 4. Team number 5. Yes. Okay, you will get plus 10 because the shape is correct. It's a capsular tension ring. The use is not correct. It is not used in a posterior capsular rupture. Up for grabs. Team number 6. Use. Plus 10. Plus 10 to? Yes. Plus 10 and minus 5. 5. Please use the mic when you answer. Use of a capsular tension ring. Okay. Say. Okay. Team number 7, that is incorrect. Minus 5. Pass. Team number 1. Use. Team number 2. Okay. Audience? Anybody? What is the use of this ring right there? All right. So it is used in a zonular dialysis. It cannot be used when the posterior capsule is not intact, okay? Okay. This is for team number 3. Identify the shape and name one use. Sorry, 4. Identify the shape, name one use. Time up, team 5. All right. Excellent. Full points to team number 5. Intacts in used. Team 5. Team 5 full points. They are intacts used for the treatment of keratoconus. Team number 5. Really sorry for that. Team number 5. Identify the shape. Where is it seen? Where is it used? Six. It's an instrument, right? 7. 8. Sorry, 1. 2. Pass. 4. Pass. Audience. Excellent. Who is this person? Big gift. The bigger gift, please. Okay, the piece. So this was for 5. Okay. Next question, team 6. Identify the shape. Where is it seen? There's a subtle shape going right here, like this. This is what we're talking about. Time up. Mike, please use the mic. There is plus 10 and minus 5, remember? All right, team number 7. This shape right here. Team number 1. 2. Team number 2. Team number 3. Team number 4. Team number 5. All pass. Okay, audience, it's all on you. That is correct. Flesher's ring seen in base of the cone and keratoconus. Excellent. Whoever answered, who has answered this? Yes. Please give him the smaller gift. Okay. Where were you? You were on 7th team. No? So now team number 1. Now we're on team number 7. Okay. Next question, team number 7. Identify the shape. Where is it seen? This one right here. This shape. Time up. Attempt? No?
Nummular keratitis.
That is incorrect because it is transparent in the center. Team number 7 minus 5. Team number 1. Pass. Team number 2. 3. Team number 4. Team number 5. Wesley's immune ring. Okay, that is not correct. Minus 5. Sorry? Yeah. Okay, team number 6. No? Audience? What say, any attempts? All of the last benchers? Okay. So the answer is quartz ring. It's a remnant of a foreign body with fine iron deposits in the Bowman's layer. Okay. Next question, team 1. Identify the shape. Where is it seen? Come on. Yes, team 1. Yes.
Pterygium. Seen in pterygium. Islets of oak.
Time up. Team number 2. Minus 5. Team 1 minus 5. Team 2. See, look at the arrow. It is pointing at something and we are talking only about shapes, not the diagnosis, right? So you have to answer in shapes. Team 2. Team 3. It's a pterygium, right? Team 4. Sorry?
Bed shape.
Bed shape.
Bed shape.
Okay, I am sorry, but I really can't hear you.
Wedge shape.
Wedge shape. No, incorrect. Look at what the arrow is pointing at and answer. Minus for team number 4, minus 5. Team number 5. Team 6. Excellent. Stocker's line is correct. Where is it seen? Pterygium, head of the pterygium. That is correct. Full points for team number 6. Stocker's line, it is the iron deposition and the anterior leading edge of the pterygium. Okay. This is for 2. Identify the shape, where is it seen? Okay, this is a little not clearly visible, so this is a shape right here. It's a little line right here. Time up. Team 3. Team 4. No? Team 5. A little line over the cornea. Team 6. Excellent. Where is it seen? All right. Team 7, only the second part. Plus 10 for team 6. Team 7, where is it seen? Only the second part. Pass? Try.
Epithelium of cornea, the condition is idiopathic senile degenerative condition.
Okay. I will give you marks for that. It is basically iron deposition over the cornea because the tear film stays there for a long time, right? Okay. The next one, is it over? No. Next one is for team 3. Okay. Team 3, identify the shape. Where is it seen? You can see the shape, right? This thing right here. Time up. Team number 4. Team number 5. Team 6. Come on. 7. 1. 2. Audience. Only UGs. Audience. Yeah, please answer. You are correct. Golden ring seen in hydrodelineation. Correct. Please give one prize for that girl. Okay. Team number 4, next question. Identify the shape. Where is it seen? It's the conjunctiva, right? Yeah. Where is it seen? Time up. Team number 5. Excellent. Full points. Team number 5. Next question. Also team number 5. Okay. Identify the shape. Where is it seen? This shape right here. Okay. Excellent. Full points. Team number 5. Next question, team 6. Identify the shape. Where is it seen? This one right here. Time up. Team 7. Can you see these subtle lines over here? Where the arrows are pointing. Okay, team 1. Team 2. You can at least try the condition. If not the name of the sign, try the condition. Team 3.
Hypertensive retinopathy.
Hypertensive retinopathy. I cannot give you marks for that. That is, no, minus. Yes. Negative marking for team number 3. Team 4. Condition at least? No? Okay. Team number 5. Audience. Patterns lines is correct. Seen in? Papilledema, yes. Where were we? Team number. Direct question to team 7. Identify the shape. Where is it seen? This is the shape right here. Time. You want to answer? Please answer first.
Vox tria seen in keratoconus.
Full points. Team 7. Team number 1. Okay, easy one. Identify the picture. Where is it seen?
Rod spots seen in
You are correct. Continue.
hypertensive retinopathy.
One part is correct, one part is incorrect. Please give them plus 10 and minus 5. Okay. Team number 2, only where is it seen? Okay.
Infective endocarditis.
Excellent. Plus 10 to team number 2. These are rod spots that are white centered hemorrhages seen in infective endocarditis. Okay. Next question, team 2. Identify the picture. Where is it seen? Shapes. Yes. Seen in? All right. Full points. Team number 2. Cotton wool spots. They said they seen in diabetic retinopathy. Okay. Team number 3. Identify the shape. Where is it seen? Come on. This is a simple one.
Horner-Tranta spots.
Excellent. Where is it seen?
Vernal keratoconjunctivitis.
Perfect. Okay. Full points. Team number 3. Last question. Team number 4. Identify the sign. Where is it seen? Time up. Team number 5 is very excited. Okay. Yes. Excellent. Okay. Full points. Team number 5. That brings us to the end of the second round. We will, do we have the total or do you need some time? Okay. So we have the total. I'll hand over to the scorer. Ma'am, please. Yes.
So the highest scoring team currently is KMC Manipal with 115 points, followed very closely by KMC Mangalore 105 points. Then we have KVG Sulia at 90, Yenepoya, the home team, at 55, AJ Institute 35, and Father Muller's at 30 points. Kanachur 5 points. You missed scoring in the first round, right? So the qualifying teams you want?
Yes.
The
Please
qualifying
announce the
teams, the top 5 qualifying teams would be KMC Manipal, KMC Mangalore, KVG Sulia, Yenepoya Medical College, AJ Institute. Yeah.
Congratulations to all the teams. And I must say everyone has put in a lot of effort and you answered a lot of questions which I thought you wouldn't have answered. Okay. So a little something for the audience.
Will they continue to be on the same spots?
Yes, please.
So
The
ones who
teams
are
that
not-
have not qualified, kindly take a back seat, please.
So you'll have to rearrange them because in the order in which they have scored, right?
Yes.
So KMC Manipal, please move on to place number 1, right? Tanvi?
Yes. KMC Manipal, place number 1. KMC Mangalore, place.
Next is KMC Mangalore.
Yes, place number 2. You can move.
Next is KVG Sulya.
KVG Sulya, place number 3. Then
Yenepoya Medical College.
Yenepoya, place number 4.
AJ Institute, number 5.
AJ Institute, number 5. We should remove okay.
No.
So this is a little something for the audience.
Remove.
So as you can see, there are 2 plus signs. The one on your left has 2 circles on its side, right? So what I want you to do is I want you to stare at this plus sign for around 30 seconds. You're allowed to blink, but try to stare at this plus sign for around 30 seconds.
It's a news.
You will see some colors over here. Okay? And after 30 seconds, just shift your gaze to the other plus sign and then tell me what happens.
Okay, which is why I'm Yenepoya.
Okay?
And AJ.
Anyone? What did you see? Does anyone want to attempt that? There is no correct answer.
AJ is 5.
So you can all attempt. What did you see on the other plus sign?
This gets zoomed now.
Tanvi, sorry to interrupt you. The clinics batches, no, except ophthalmology, may have to go to their clinics unless you have specifically asked for permission yourself, because we have not got any permission for the rest of the batch. So you may have to go to your clinics. Okay? Yeah.
Is this okay? Name of the college. Shall I zoom one more point? One second. No, we'll add. Yeah, we'll add.
Anyways, they're all moving. All right. Oh, I forgot to put this.
Tell me what was 115, I think. I do. 19.
So you probably saw a yellow and red circle. Did you notice that they were not there before you started this experiment?
We'll just check.
Unlike the colored circles on the left, the ones you saw on the right moved
I
around
love
as your
Enviro
eyes
Elements
moved.
because it
This
is a
shows that they are not optical illusions, but they are after images that are there in your eyes. So this is one of the examples of after images.
Control. Cut. Add it at the bottom. Because that. Yeah, it's coming now. And you take this. Control. Cut. Let it go. Where did I write that? Here, right? So this gets pasted here, correct? Correct, no? Correct, no? Yeah, at the bottom. And I'll delete that. So you can also in your master's portion. Go to master. Yeah, master. Somewhere right here. Or right here, right? You can write it as a
The screen is visible for all of you, right? Okay. So the next 3 rounds are buzzer rounds. Please everybody check whether your buzzers are working or not. Can you please press again? Okay, you press again. Team number 2. Okay, fine. So I need one volunteer to please sit here and tell me who pressed the buzzer first because it is not facing that side. Yes,
One of the
Dr.
first
Ashok,
here.
please
Yeah,
come
Dr.
here.
Ashok.
You sit over here.
You can sit on one of the,
Sit in
this
chair.
team 6. Yeah.
Weight is there this side. Okay. So now that we have learned about anatomy, physiology, optics, and we have learned how to identify clinical signs, it's time to use our brains a little more and add those 2 plus 2. So what happens is, when the patient comes to you, what we are generally taught is clinical history plus clinical examination will give you a diagnosis, right? What you have to do as a doctor is to find a common link between whatever history is given, between whatever signs are seen. This round is finding all about finding common links, or as Sherlock would say, it's all quite simply elementary. Let's begin this round. So it's a buzzer round, okay? There are total 20 questions. Just 1 second. So there are total 20 questions. You will be provided with clues and your job is to find the common link between the clues. Your job is not to find a diagnosis, your job is only to find a common link. Okay? Give precise answers. There are no points for generalized answers. Correct and most precise answer will get plus 10. Incorrect or vague answer, minus 5. It's a buzzer round and it's passable only once. That means, for example, if team 3 presses the buzzer first, team 4 presses the buzzer second, team 3 will get the first attempt. If it's correct, you will get max. If it's incorrect, you will pass on to team 4. Understood? If team 4 is incorrect, it will pass on to the audience. Okay. The time limit per question is only 10 seconds, so buckle up. The timer will start as soon as the picture is up. Okay? All right. Let's begin. All the best. 4. Common link. Team 1. Excellent. Team 1, full points. Als triangle is one part of it. That one is the als line, correct? So now you get the hang of it. Team 1, full points.
No minus points, right?
No. Next. Question number 2. Time up. Nobody? Okay. Audience? Question number 2. Yes, ma'am, please. Von Graffe, excellent. That is the Von Graffe is knife. That is the Von Graffe is sign. Okay? Seen in? Excellent. Okay. Next question. Team 3. Excellent. Oil drop. First is oil drop reflex. Second is oil drop cataract. Okay? Next question. We've done this before. Team 2.
Leisure.
That is incorrect. 3. That is incorrect. Moving on to the audience. Minus marks to team 3.
2 and 3 minus.
Yes. Sunflower and Pleasure's ring point to what? Yes, someone said that. It's copper deposition in the eye. Right? Both of the signs are about copper deposition. Okay. Next question. Be ready.
Team 2.
Team 2.
Blunt trauma to the eye, this Washer's ring and rosette
Excellent.
cataract.
Full points. Team number 2, full points. 1.
Team 1.
Think now that you've pressed. Hutchinson, excellent. Can you explain the second picture? Now that you've answered. Okay, full points to team number 1. Anybody? What is the second picture? Hutchinson's pupil, excellent. Okay. Next question. Come on. Time up. Audience, your time to shine. Yes, ma'am, you are correct. What is the first picture? This opposite, sorry. What is this thing right here? That's a pseudogerontoxin. And this is opacity of a shield ulcer. Where are these things seen? Chronic allergic PKC. Okay, fine. No points to anybody for this. Okay, next question. Be ready. 2. Team number 2.
Dermoid.
Incorrect answer, minus points. Up for grabs, other teams. Alright, audience. Golden Har, that is correct. Bigger prize to that lady right there. Okay. Next question. Simpler one, come on. 3.
Team 3.
Excellent, that is Down syndrome. Almond eyes, polydactyly and trisomy of the chromosome. Okay. Next. 4th. Yes, Marfan syndrome is correct. Okay. Full points to team 4. Next.
Team
4. Excellent, vitamin A deficiency. What is the second picture? Corneal melting, keratomalacia. Okay. All right. Next question.
Team
2.
Panretinal photocoagulation.
But there are 4 pictures.
Okay.
Negative marking. What?
NDR laser.
All right. Okay. I wasn't thinking of that answer, but that also can go in this. No, actually, that doesn't go in this. It is incorrect. This ND actor is not used in the first 2 pictures. Negative marking to my team 2. Team 1. Excellent. Laser. I saw the last picture. Laser treatment. Next. Simple. 1. Alright. I'll give you these marks. number 1. It's granulomatous uveitis. Okay. Next. Now you have to really think.
Team
3. Common link. Negative point. 1. Excellent. Full points. What is the first picture?
Which team is this?
Excellent. Beerham's tangent screen. Beerham's scotoma. All right.
Next is
Think. 2. 2.
For retractor
Think. There are 3 pictures.
and toxoplasm. No, cat, toxoplasm.
Next. Negative marking there. Team 4. Excellent. Cats. The answer is only cats, not cats per retractor. Right? Negative marking team 2. Points for team 4. Precise answers, full marks. Vague answers, negative marking. All right? Next question. Be ready? Think. Nobody? Nobody. Okay. Audience, open to audience. Excellent. Chloroquine toxicity is the right answer. Treatment for malaria, rheumatoid arthritis, and drug toxicity in the eye. Next. That is the Silk Route. 2. Just 1 second. Just 1 second. Team number 2. You pressed.
Geography.
1 second. That is
Check the
incorrect.
buzzers.
Minus for team 2. Just try to press it. Okay. Please shift that buzzer here. No. Wait. Now is it working?
Wait.
Can we just shift this buzzer, sir?
He'll do.
Hello. So repeating the buzzer again for the same question, everyone except, which team answered it wrong?
Team 2.
Everyone except 2 eligible. Yes, please one.
Team 1.
Batches, that is correct, full points. Okay, next, all ready? Use your imagination. Time up, no attempts. Audience? Sputnik, excellent. That is the Sputnik satellite, this is the Sputnik vaccine, that's the Sputnik ion. Okay, next question. Simpler one, 4. Goldman, correct. Alright, I think, yeah. Last question, be ready.
Team
1. Excellent, mark is done, no prompting audience, please. Okay, that was quite an exhilarating round. I think everyone is now getting in the groove. They're turning up the heat. All right. Can we have the scores, please?
So at the end of round 3, Team 1 has a score of 185. Team 1 is KMC Manipal. Next, Team 2, KMC Mangalore, has a total score of 90. Team 3, KVG, has a total score of 100. Team 4, Yenepoya, has a total score of 95. And Team 5, AJ, has a total score of 35.
Excellent. Good work, everyone. Let's move on. Okay. This round is what I like to call the Nana round. You see, ophthalmic surgery is not like any other surgical branch, right? Our principles are different, our techniques are different. Like if you talk to a general surgeon and an ENT surgeon, they wouldn't understand what we're trying to say, right? On the other hand, the treatment is nothing short of miraculous. We get very good results very fast. And that's what we hope for our patients, that like Naina, they both find good vision and happiness. Going to the ground rules. There are total 20 questions. Again, it's a buzzer round. You will be quizzed on ophthalmic investigations and treatment modalities. It's a buzzer round, so fastest finger first. No passing is allowed. It will go directly to the audience. Right, precise and complete answer +10. Wrong, vague, incomplete answer -5. Maximum time to answer question 15 seconds. Okay? All set, all ready, all buzzers working. Okay, let's begin. Name 2 and Team 2. 2 indications, 2 complications.
Radial keratectomy. No.
Negative marking. For team 2, the question is indications and complications. Please listen to the entire question.
Indications will say. Name is also.
Name is not an indication.
Name to indications. Okay, like that.
That's what. Let me complete my question.
Uh-huh.
Name 2 indications and 2 complications.
I see.
And radial keratectomy is also incorrect name. Okay? So negative points to second team. Open to audience. 2 indications, 2 complications of this surgery. All right. 2 complications. bigger prize for this gentleman right here. Perfect. Excellent. Please give him a big round of applause. He's paying attention. Yes, definitely. So it's a really long list of indications and complications. Question 2, all set. Start. Name the route of drug administration. Name the one drug given by this route. Team 1. Negative marking for team 1. Negative marking. Audience. Excellent. Subtenance, posterior subtenance injection. Look carefully at the site. Triamcinolone acetate is one drug. Okay. Next. Name this test, one use of this test. 2.
Fluorescein dye, which is used in corneal ulcers.
Negative marking for team number 2. Audience. Excellent. Seedles test. Use. Bleb leak is also correct. One indication. Okay. Alright. Next question. 4 uses of this drug in ophthalmology. Buzzer round. Okay, time is up. No attempts? That was a simple question. It's too late. Sir, it's too late. Audience? Simple question, audience. OPD uses, OT uses, so many uses. Alright. So it's a viscoelastic substance. It's used for forming and maintaining anterior chamber, viscodissection, viscomydriasis, inflating and isolating sac, gonioscopy, slit lamp laser, etc. Next question, be ready. What is the name of the principle on which this drug works? Name 2 uses of this compound in ophthalmology. Buzzer round. Yes.
Principle is fluorescence.
Excellent. Next.
2 uses of this compound. One is to detect corneal defects and fluorescein angiography.
Excellent. Full points to team number 2. Next question. All set. What do the rings indicate? What do the dots indicate? Team 3.
To correct astigmatism also it's used.
Minus points for team 3. The question is, what do the rings indicate? What do the dots indicate? You've got a negative marking. Audience. Exactly. The rings are for different foci. What are the dots for? For the axis. Excellent. Please listen to the question before you press the buzzer. Okay. Next question. Name the test shown. Where is it used? 2.
Gonioscopy.
Negative marking for team 2. Okay, audience. Excellent. Van Herrick's. It's not gonioscopy. Use anterior chamber depth. Okay, fine. Next question. Listen carefully. Name the disease that is classified into these okay. 2.
This is retinopathy of prematurity.
Okay. Indication for screening.
Indication for screening is less than 28 premature deliveries and less than 1.5 kgs. High oxygen supplementation history.
Anupama ma'am, please tell me if that is correct. Okay. Fine. We'll give you these marks, full points. So always remember, the answer is 234. 2 kgs, 34 weeks. Okay, that's an easy way to remember. Next question. Name the classic pattern shown in A and B. 5. Yes, 5, come on. Yes, A and B. Second one? Sorry, first one? Correct, that is correct. Full points to team 5. Blot and smokestack. Question 10. Name the surgery shown, identify the correct sequence of steps. No. Full, complete, precise answers. Time up. Anybody? That's the eyeball right there, so you can guess what surgery that is. Exactly, that's enucleation. Sequence of steps? It's A, B, C, D, okay? Peritomy, isolate muscle, cut no. Done. Okay. Next. What type of refractive error is commonly associated with this condition? What is the mechanism of squint in this condition? One. Yes. Okay. Yes. So what happens? Accommodation. Excessive accommodation, excessive convergence. That is correct. Full points to team 1. Next question. If Shah Rukh Khan had glaucoma in his right eye, which class of anti-glaucoma drug do you think he was using? Describe the mechanism of action of this drug. Yes, 2. Class of anti-glaucoma drug.
PGF2 alpha analogs, latanoprost.
Okay.
Mechanism of action is increasing the uvoscleral outflow.
All right. Full points right there. Moving on. Name the test. What is the next step if this test is negative? 1. Yes. Excellent. That is correct. Next question. Name the procedure, 2 complications of this procedure. All right. No answers, audience? Name? Excellent. Intravitreal injections. Okay. Simpler one. What is P1, P2, P3, P? Okay. 2. Yes.
The fourth one is upside down.
Yes.
Because it is.
It's a real inverted image.
Okay, fine. It's a real inverted image formed on the posterior capsule. Team number 2. Full points to team 2. Name the test being performed, advantage over the conventional test. Audience, immersion biometry. Excellent. Next. Yes, 3. Yes. Decide. 15 times, okay. Full points to team 3. Team 3. 18. What procedure is shown? Name 2 complications of these procedure. Yes, 2.
retroburbar anesthesia.
All right.
Complications are global perforation and intraorbital hemorrhage.
Okay. Full points, team 2. What surgery is shown here? What are the properties of tissue used in this surgery? Audience, first part, amniotic membrane transplant. All right. Last question, be ready. Okay, one. Name these devices. Each of them. All right. What are they used for? What are they used for? You answered the hard part. What are they used for? Yes. So close. That is not correct. Anybody? Audience, use pupil expanders. They are pupil expanders. They used to expand the pupil. No marks. -5. Yes. So close. Please listen to the entire question before answering. All right. That concludes round number 4. Can we have the scores, please?
Hello. So at the end of 4th round, KMC Manipal has a total score of 195 points. KMC Mangalore 125 points. KVG 105. Yenepoya 95 points and AJ with 45 points.
Okay. Moving on to round 5. This is my favorite round because it goes beyond your textbooks. It has absolutely nothing to do with your textbooks. And I like to call it Nerd Level Pro Max because you will really have to be a nerd to read so much. So we are going to venture into history and literature and mythology and politics along with Buzz Lightyear to infinity and beyond. Okay, so this round is also a game changer because the stakes are really high. You get 40 points and 40 plus and 20 minus points. Let me just explain to you the format of this round. Okay? So the points depend on which stage you answer. There are 3 stages. If you answer the question on the first hint, you get plus 40, negative minus 20. On the stage 2, it is plus 30 minus 15. Hint 3, it is plus 20 minus 10. Alright? It is a buzzer round. Time limit is 15 seconds. It is passable twice and then to the audience. Understood, everyone? Okay, let's begin. This is the single largest blood component containing salt, enzymes, antibodies and proteins. Name the scientist to coin this term for blood component. Okay, hint number 2. He would meditate at dawn during long walks in the blossomed Bohemian fields. He noticed that his favorite flowers appeared red on a sunny day, while at dawn they looked very dark. So he reasoned that the eye may be having two systems that is adopted in different light intensities. Who am I talking about? Hint number 3. Yes, team. Perkinia, that is the correct answer. So I've been practicing this name quite a lot. It's Juan Evangelista Perkinie. He was a Czech anatomist and physiologist. He introduced the scientific terms plasma and protoplasm. He noticed the shift in illumination depending on the sensitivity to light, and he recognized the Perkinie shift phenomenon. Okay? All right, that was a really nice guess. Moving on to question 2. Okay, so this is a story about two doctors. Dr. I was a major in the United States Army Air Force. He performed experiments on rabbits to study the effects of steroids on corneal scarring and taught optics and refraction to the residents. In September 1952, he reported a newly defined disease following cataract surgery based on a clinical study of 2,000 patients. The pathophysiology of this condition was later demonstrated on an FFA by Dr. G. Name the eye disease being referred to here. It's about Dr. I and Dr. G. Yes, 5. Only more specific answers to be accepted. Do I accept cystoid macular edema as the answer? Alright. Cystoid macular edema is the thing that happens, but that disease has a name which is called Irving-Gass syndrome. That is excellent, but points to here. Okay, points to team number 5 plus 40. That is excellent. So about Dr. G, he was a father of macular diseases who invented FFA and then started taking classes weekly, effectively ruining our weekends. And that is a photo of Irving-Gass syndrome. That is also cystoid macular edema. All right. Next. Okay. So we're talking about a disease. His father died young, so he had to work to provide for his family and his education. He went on to a medical school where he conducted a thesis in which he concluded that papilledema in childhood meningitis was caused by obstructive hydrocephalus and not by inflammation of optic nerve. Name one disease named after this legend. Not the person, the disease. Difficult hint. But if you can guess, the stakes are really high. No? Alright. Hint number 2. Sorry. Yeah. Hint number 2. Dr. P described 2 cases of convergence paralysis. So I'll just shorten this. He found masses in the midbrain of these patients and finally found that the pupils of these patients reacted to light but did not react to accommodation. What disease are we talking about? It was exactly opposite to what Argyll Robertson said for syphilis. Another hint is Dr. P. Okay, last hint. This is a simple one. He wrote on a form of conjunctivitis associated with prominent preauricular and submandibular lymphadenopathy that was disproportionate to the severity of eye infection. This is now mainly known to be caused by Bartonella Hensley. Name one disease named after this legend. So we've described 2 diseases. You can name any one. Sorry? It's plus 20 minus 10. What is this disease that we're talking about? Yes, 5. That is not correct. It does, but this is not the common link between these three hits. It can also cause other thing, right? So anybody? Yes, perinod. Somebody answered that correctly. So it is perinod ocular glandular conjunctivitis, perinod dorsal midbrain syndrome, named after Dr. Henry Perinod. Okay, this is a simpler one. Pay attention. Goddess of fate and destiny. How is she related to ophthalmology? Venturing into mythology now. Okay, time up. Hint number 2. The substance which we are referring to was previously used to prevent low vision in eyes with cataracts involving only the central portion of the lens. The audience is ready with the answer. No guesses? Alright, hint number 3. It was also used to make poison tipped arrows and used by women as eye drops to make them look seductive. No guesses? They're eye drops. Alright, audience, please. Sorry? Atropine, exactly. Atropa belladonna is a very commonly known poison. So the goddess, the sculpture was of the Greek goddess Atropos, which is also known as the goddess of death. So people used to pray to her for a longer life. Next question. The Adventure of Silver Blaze, The Adventure of Golden Prince Nez. Relation to ophthalmology. Venturing into literature now. This is literature, okay? Hint number 2. When you have eliminated all of which is impossible, then whatever remains, however improbable, must be the truth. This is a very famous quote by a very famous author. Audience? No, don't answer, wait. Yeah. Hint number, yes. Exactly, sir. Arthur Conan Doyle. So the first two are the books that he wrote which have references to ophthalmology in his book. In the first book, a cataract knife is found at the crime scene. In the second book, a spectacle becomes an evidence that is used. Okay? Alright, next question. In the middle to end years of the war, he was with the Royal Army Medical Corps, posted in West Africa and Southeast Asia. So all of the patients there had onchocerciasis, but he did not have any device to document it, so he used to watercolor paint it. So he treated around 200 Allied prisoners who were suffering from nutritional amblyopia, who developed a scotoma. Who are we talking about? No? Okay. Hint number 2. He traveled to Pune and Calcutta before returning to the UK. His most groundbreaking work, like many other innovations, was ridiculed and criticized in the Oxford Congress. The criticism was largely led by the legend and his superior, Sir Duke Elder. Alright, hint number 3. Yes, 3. Who are we talking about? Okay. Alright, full marks, it is his first name. So Harold Ridley is the correct answer. The fun part is that he himself benefited from his own innovation, got both eyes intraocular lens implantation done. Okay, next. The only ophthalmologist to win a prize, Nobel Prize for work in ophthalmology. Yes, 3. That is incorrect, unfortunately. Minus 20 for team 3. Anybody else? Any other team wants to try out? All right, hint number 2. Yes. Excellent. Full points plus 30 to team number 1. So this is the slit lamp that he invented. What is this? Yes, Alva Gerstner schematic eye. Next. Okay, so this is a great question. This celebrated impressionist worked mainly in blue and cool tones for many years, yet at the end of his life, his canvases were a riot of reds and yellows in an apparent about turn because of an ocular condition. Name this disease. These are some of the paintings that he made. Alright, hint number 2. Another famous artist whose life was full of tragedy and self-destruction, ending with suicide, was known to suffer from a lot of mental illnesses. So he was admitted in a psychiatric ward where he was started with digitalis and suffered from the same ocular condition. Name the condition. Alright. Hint number 3. These are the famous, really famous paintings that the artist has made. All we are talking about is the ocular condition, not the name of the person. Audience. Starry Night is the painting, I agree, but the name of the ocular condition. Partly correct. Somebody said nuclear sclerosis, which is partly correct. Okay, so I'll just tell you the answer. It is xanthopsia. Okay, it's an overriding of yellow vision. First artist was Monet. He suffered from nuclear sclerosis induced xanthopsia. Second artist was Vincent van Gogh. He is believed to have suffered from digitalis induced xanthopsia. Okay? Okay, I'm just open as this. We'll go on to the next question. Okay. Uttar Tantra contained elaborate descriptions of 76 eye diseases. These included diseases such as glaucoma, uveitis, cataract and trichiasis. Name the author of this book. 3. Excellent. Full points. Team number 3. Well done. That brings us to the end of this quiz. By the time they do the point total, we'll just interact a bit with the audience. You ready?
So
Ready with the scores? Please.
So the final scores are Team 5 from AG Institute of Medical Sciences at 75, Team 4 Yenepoya 95 points. At third place is team from KMC Mangalore with 125 points. Runners up KVG Sulya, and the winner of this quiz KMC Manipal. Congratulations.
Thank you, Dr. Tanvi, for this wonderful quiz. I now request our guests for today, Sridhar Shenwa and Mrs. Jyoti Shenwa, to please come on stage. So they are parents of our alumnus Shruti Shenwa, and they have sponsored the undergraduate intercollegiate quiz trophy. So for the last 14 years, we've been conducting this, and they have been kind enough, they have been kind enough to sponsor it. I also request our medical superintendent, Habib sir, to please come on stage. Everybody please give a hand. I request our former head of department, Dr. Vidya Hegde, to please give our, to welcome our guests, Mr. Sridhar Shenava and Mrs. Jyoti Shenava. Sir. So I think we will, since we are running a little late, we will have the prize distribution now. The rolling trophy will be given by sir, and the rest of the prizes will be given by our beloved MS sir. Rashmi. UG trophy. Adu correct trophy. So the first place and the winner of the Sridhar Shenava Rolling Trophy undergraduate quiz competition goes to KMC Manipal. Please come forward and receive your prestigious trophy. We have the certificates. Names can be written later. So the second place goes to KVG Sulya. Please come forward and receive a certificate from our medical superintendent. Second place. The third place goes to KMC Mangalore. So all the prize winners, if you can come on stage, we'll have a picture, and then with the department and with the other participants. Please come, the prize winners and then all the participants. Come fast, please. Come, quiz master. come for a picture. All staff members? I think the participants can stand here in the front, and yeah, stand. More chairs, ಅವ್ರಿಗೆ ಅಷ್ಟೇ. ಇಲ್ಲ ಸರ್, ನೀವು ಕೂತ್ಕೊಳ್ಳಿ. Then we'll have madam ಬನ್ನಿ. We'll all break for tea now, and after 15 minutes, we will assemble again for the PG quiz competition.
I request PG teams to come forward for the lots. All the 6 teams to come to the stage, please.
சர்ச் பண்ணுங்க அப்படின்னு பார்க்குறேன்.
ತಿಂತೀನಾ ಪೌಚಲ್ಲಿ ಇಟ್ಟಿದ್ದೀನ ಯಾರಿಗೂ ನಾನು ಪೌಚಲ್ಲಿ ಇಟ್ಟಿದ್ದೇನೆ ಅಂತ ಗೊತ್ತಿಲ್ಲ ಬ್ಲೂ ಕಲರ್ ಪೌಚ್ ಪೆನ್ ಯಾವುದು ಥ್ಯಾಂಕ್ ಯು What is the pulse oximeter? We'll put some pulse oximeter and see. My pulse will be the highest, I think. Start aitala buzzer do. We'll just check the buzzers once. Okay. Yes, team 1 working, team 2 working, team 3 working, team 4 working, team 5 working. Perfect. All the buzzers are working. Okay. So you have a sheet in front of you. Okay. All can see the screen well. The last team 1 can see the screen well, right? Let them come. I'm also waiting. See these other teams. We'll introduce each one. Okay. Enta illa waiting. ಕ್ಯಾಮೆರಾ ಮತ್ತೆ ಅಲ್ಲಿ ಇಡ್ಲಿಕ್ಕಾಗುತ್ತಾ ಎಲ್ಲ ಕವರ್ ಹೌದು ಇಲ್ಲಿ ಉಂಟು ಅಲ್ಲಿ ಬಿಟ್ಟರೆ ಎಲ್ಲ ಕವರ್ ಆಡಿಯನ್ಸ್ ಕೂಡ ಕವರ್ ಹಾಂ ಅಲ್ಲ ಇಲ್ಲಿ ಇಟ್ಟರೆ ಸರಿ ಇದೆಯಾ ಲೈಟ್ ಕ್ಲೋಸ್ ಮಾಡಬೇಕು ಸುಮ್ಮನೆ ವೇಸ್ಟ್ ಆಗುತ್ತೆ ಸ್ಟಿಲ್ ಲೈವ್ ಇದೆ Vidya, we'll start the introduction. No? Okay. So, I think it's good morning still. Okay. Good morning to all. Good morning. If you can't say good morning, then I want to hear your answers also. So, be loud. Good morning to all. Very good, now I can hear it. So welcome to the Yenof quiz. And as you all know, it has been there for a long time. Every year there have been, the trophy has been moving from one college to the other. The last trophy was with KMC Manipal. So now we want to see whether they will take it back or they will hand it over to somebody else. Of course, the new version of the trophy has come. The bigger one is all full, the names are all full, so it will be deposited in the principal's chamber in Yenepoya, and the new trophy will start rolling now. Okay, so shall we start? Dr. Sheetal, shall we start? Okay, so let's meet the teams. Dr. Sheetal, please give away the rows to the first team. Team number 1, no, we'll go by this only. Number team because we have only 5. So team 1 is Prasad Netralaya, and this is the first time we have a team from Prasad Netralaya. So a grand welcome to Prasad. Please introduce yourself.
Good morning.
Good morning.
Myself, Dr. Krishnakant, and I'm first year resident from Prasad Netralaya.
Welcome.
Hi, good morning. I'm Dr. Ahana from Prasad Netralaya, first year.
Welcome. So we don't welcome home teams, so anyway they will introduce. Yeah, please introduce yourselves.
I'm Dr. Ashwin Sagar from Yenepoya Medical College.
Yes.
Sarita from
Please
Yenepoya.
hold the mic well so that we hear your answers well. Yeah.
Sarita from Yenepoya.
Yes. Team 3.
Good afternoon. I'm Dr. Saundar. I'm from KMC Mangalore. Hello. I'm Dr. Saundar from KMC Mangalore.
Hello, I'm Dr. Anuja from KMC Mangalore.
Team 4, KMC Manipal.
I'm Nihet from KMC Manipal.
I'm Dr. Ashrit from KMC Manipal.
They are the defending champions. Team 5, AJ, Institute of Medical Sciences.
Hi, I'm Roshni from AJ.
I'm Shruti from AJ Medical College.
Nice. Welcome. All the best. Team 6 is from Father Muller's Medical College.
I am Dr. Lakshmi from Father Muller Medical College.
I'm Dr. Pooja from Father Muller Medical College.
Yes. Yeah. So all the best to all the teams. Shruti, Roshni, Pooja, Lakshmi, Anuja, Saundar, Ashrit. You have to help me. Nihit. Then Ahana and Krishnakant, and finally Ashwin and Sarita. So all the best to all the teams. Shall we start with the first round? Yeah, you all are ready? Okay, fine. So before that, let's see who has won the quizzes before. Started with KMC Mangalore. When it comes to your team, you should raise your hands or say something, okay? First was KMC Mangalore. Second was KMC Manipal. Second quiz winner. Third was Yenepoya. Third, fourth and fifth hat-trick was by Yenepoya. Say yes. Yes. Then was again KMC Mangalore. Oh, loudly. Loud. Energy level. Then we had a team from Calicut as a, surprise event. And they won. Again, it was Yenepoya, Kasturba Medical College, Mangalore. Where? Yes. Then KMC Manipal again. Then KS Hegde Medical Academy, they are not here. We will all cheer for them. Then was again KMC Mangalore. Then Yenepoya. Then last time it was Kasturba Medical College, Manipal, followed again by Kasturba Medical College, Manipal. So these were our winners. Let's see who's going to be. Your photographs will come in the next quiz as winners. Okay, shall we start? Okay, so this is our outline, what say, I'm gone. Layout. Layout of the quiz. We have first round on basics, okay? So we'll all start with basics, and in basics, because it is itis, it is one round is on infections, one round is on inflammations, all basics. Next we have a clinical round. In clinical round we have ocular round and an extraocular round, okay? Then 3 is again any itis. It can be anything related to ophthalmology, itis, spot the diagnosis. That is a buzzer round. 4th round is a special round which is called a Wordle round. Are you all aware of the new game Wordle, which all of us are playing, most of us are playing, no PGs are not playing, only staff members are playing. So let's play it now today. And round 5 is the buzzer round, which has got 20 questions. Okay, so we start. Before that, I'll just introduce the scorers. We have Dr. Elizabeth and not doctor, to be Dr. Avnish with us, who are going to help us with the score. And we have Jagdish here for the buzzer. He is also there. Bhushan is also there, I forgot. Jagdish is helping us with the buzzer, and Ganesh is there for mic help. If anything is there, please ask us. And we have my whole department as a support for us, including Gayatri and everybody. Okay, shall we start now with the basics? Yes. This is called a matchmaker round. Okay. So you will be given the name of an organism. Okay. And there are 8 images which are given along with it. You have to match which of that image is caused by the condition in that image shown is caused by that organism, and identify which is that condition. We have a demo, don't worry. So there are marks are +10 and +10 for the 2 and two parts. They have to identify the image, 10 points. They have to identify the condition, 10 points. So it is total is 20. And if you take second attempt, then we can give you 5 and 5 points. Okay, so we'll have a demo first. Are you ready for the demo? Okay, so this is the, for audience also. Okay, this is the way the layout is going to be. The organism given here is Neisseria gonorrhoeae, and there are 8 images there. You have to identify which image reflects the condition caused by the organism, and also name that condition. 2 things here, 10 and 10 points. So does anyone want to give the answer? 7. So you have to be loud when you answer. So image number 7, and what is the condition? Yes, this is how it is going to be. Easy? Looks like, right? Okay. So we start with, so we have the answer here. Okay, we'll start with the first team. Team 1? No negative, no passing, nothing. Okay, you play your game yourself. So team 1, are you ready? Team from Prasada. Okay. Human papilloma virus is the organism or agent. Which is the image? Yes? Time is up. Now you have to answer. Quickly you have to answer. Which is the image and which is the condition? Loudly, clear. No negatives, so you can take a chance.
We guess it is 2.
2. What is the condition you are seeing? What is the condition caused by human papilloma virus? Huh? No. Can we give it to them? No. Which is the condition? Anyone from the audience? 6. What is the condition? OSSN. So the condition is OSSN, ocular surface squamous neoplasia, and the image is 6. Okay, so who answered? I think Divya answered. We are not Divya. Soumya answered. Hey, someone give the audience prizes here. Seth. Okay, fine. So we go to team 2 now. Team 2, are you ready? Team 2, yes. So we have the organism alpha hemolytic Streptococcus viridans. There are 8 images. Identify which is the condition caused by time is getting over. Yes?
Number 7.
7. And what is the condition?
Rot spots.
No. Can we give it to them? No. What is the condition caused by anybody else wants to just try? Anyone from the audience? 6. 1. We'll take all the clues. 3 is the correct answer. And what is the condition? Yes, it is infectious crystalline keratopathy. They are very, very specific organism which causes this condition. So it is post-keratoplasty. Prize, where is safe? Yeah. Hey, be here, man. Don't go and sit. Come, give. Okay, team 3. Team 3. Okay. Ready? Yeah. So the organism is Propionibacterium acnes. Yeah, go ahead.
7 endophthalmitis.
7?
Endophthalmitis.
Okay. Any specific answer you want to give?
Exogenous post-surgical endophthalmitis.
Okay. Is it 7? I can't give it to you. I can't give it to you. Does P. acnes give rise to such a fulminant endophthalmitis? What does it give rise to? Yeah, please answer. 3 is the answer. And what is the condition? Delayed endophthalmitis. That is the condition. And the image is 3 and it is not 7. 7 was meant to be a distractor and it won today. Okay, no scoring so far. Let's see whether team 4, the defending champions, will crack this. So team 4, ready? Moraxilla Axenfeld. Yes, 1. Angular conjunctivitis. Okay, 10 and 20 points to them. Very good. We'll go to the next now. Team number 5. The question is Toxocara canis. You need luck also in quiz. Yeah. 2. And what is the condition caused by this? They get 10 points. What is that condition called, wherein it is affecting some particular part of the eye, right? Huh? Choroiditis. So we give them 10 points. DUSN is the correct answer. So they get 10 points. Team 5 get 10 points for this. That okay, I'll display the answer in case somebody has not got it. So it is DUSN. Next, team 6. Are you ready? Let's see how you score here. So it is herpes simplex virus. Which image?
7.
7. And what is the condition? 20 points to them because they have got, why not 2? Okay. Okay, the answers are correct. So 2 teams score full and 1 team scores half and the others are yet to score. Let's have one for audience. Let's see now. Are you all ready? Okay. So this is the question. Very easy. Number 3, what is the condition? Biotot spots, yes. So I think we have one more audience question. Audience prize have? You can't sit. Okay, one more question for the audience. And tarantula. Let's see who answers this. 1. Wrong answer, what to give? Take the chocolate. Yeah. What's the correct answer? 1. No. Again, wrong answer. 8. No, wrong answer. Wrong answer. 6. No. What is remaining now? 7. So I'll give you a clue. It is a crab. Tarantula is a crab, okay? The hair of the crab, no, the hair of the crab can give rise to something. Granulomatous inflammation, 3. 3 is the answer. That is ophthalmia nodosum. Okay, so that is the condition. So this was mainly meant for, okay, so we finished the infections round. We realized that we don't know too much about the infections. We'll try to see whether we know a lot about inflammations. Okay, so this again is a basic round about inflammations around the eye and orbit. Okay, so we'll start. You have again, I'll show a demo again. You can have 2 attempts here. Okay, we'll give you 2 attempts, +10 and +5. There's only one answer you have to give here. So how does it go? There's one condition or whatever process related to inflammation given here, image, and here it is retinitis pigmentosa. There are 8 points written there. You have to tell which one is wrong. This is a mismatch round. Okay, you have to tell which one is wrong. So I'll read out retinitis pigmentosa, arterial narrowing, yes or no? Yes. Correct, right? Delayed dark adaptation, bony pigments in the retina, inflammation of the retinal photoreceptors, yes? No, it's a misnomer, there's no inflammation there, right? So you have to identify which is the wrong answer here. So there's one image and related to inflammation, not clinical but related to inflammation. So we now start with team 6. Are you ready? Reverse. Ready? Okay. So the question to you is the Langerhans cell. So basics of inflammation. Present in the conjunctiva, present in the cornea, derived from limbal stem cells, antigen presenting cell, many dendrites, Burbeck's granules. They express class 2 MHC antigens, and confocal microscopy is used to detect them. Which is the wrong one? You have 2 attempts to answer.
Class 2 MHC antigens?
It's not. That's a wrong answer. It is class 2 MHC. That's not the right answer. You can take one more chance.
Did I?
That's the right answer. Where is it derived from then? It's not coming from the limbal cells. It's coming from the bone marrow. Okay. So that's the right answer. They get 5 points here. Okay. Good. Very well done. So we go to team 5 now. Team 5, are you ready? Okay. Anterior chamber associated immune deviation. Okay. It downgrades delayed hypersensitivity reaction. It's a model of immune privilege of the eye. Involves suppressor T cells. It is processed in the spleen. It is processed in the lymph nodes. Elicited on injecting antigen into the AC. Prevents corneal graft rejection. Inhibits CD4 T cells, CD4 cells. Which one of these is wrong? Inhibits T4 is wrong. That's not the right answer. You have one more chance. See if you have read the ACAD diagram, you will know what is wrong here. Quickly. Processed in the lymph nodes is the correct answer, but you have to tell me why. Okay, that's right. So they also get 5. There's no lymph. Yeah, she wants to say. She's excited.
Actually, the whole concept of immune privilege started because
no lymphatics. Very good. So they get 5 points there. Good. Please cheer them. Analog. It was used in psychomore study. It is teratogenic. The dosage is 10 to 25 daily dose. Liver function tests are done for monitoring. Good efficacy in children with uveitis.
225 mg daily dose.
Then what is the dose?
It's a weekly.
Perfect answer. 20 points to them. Sorry, 10 points to them. Very good, very good. It's a weekly dose. So that's done. This is it for you. The question is MAN2 test. Purified protein derivative is injected. The injection is given intradermally. It is also known as Mendel MAN2 test. It elicits delayed hypersensitivity response. The test is read on day 2 or 3 after injection. Used for screening or diagnosis of tuberculosis. Diameter of erythema is measured and previous BCG vaccination false positive test, which is wrong. Perfect answer. 10 points to them. Very well done. Good. So we go to the next. Are you ready? Yes? For all the questions. Let's see now. Human leukocyte antigen. It's a major histocompatibility complex gene. Plays a role in autoimmunity. B27 can be tested by PCR. Behçet's disease is associated with HLA-B51. HLA-DR2 is associated with multiple sclerosis. HLA genes are located on chromosome number 11. HLA-A29 is associated with birdshot. You have 2 attempts. Quickly.
HLA-A29 is associated with birdshot chorioretinopathy.
That's actually correct. So that's the wrong answer. You have one more chance. HLA-DR2, though that also is the correct. What is the correct answer? 5 and 5-1. Yes, it's also correct. Which is biologics. They are immunomodulators. This is a, I have to stand here. Adalimumab is a chimeric monoclonal antibody. Tofacitinib is a Jason kinase inhibitor. Infliximab is anti-tumor necrosis factor antibody based. Rituximab is targets CD20. Adalimumab was tried in visual studies, usually tried after corticosteroids and conventional immunomodulator drugs, useful in non-infectious uveitis. It's very, very basic.
Adalimumab was tried in visual 1 and 2 studies.
Chimeric, it is human monoclonal antibody. You may remember me, human, okay? So, X. Yeah, that should go to her. Okay, so we don't have team 7, so it's open for the audience now. Are you all ready? Yes. It is about graft rejection. Steroids are the mainstay of treatment. Immunomodulators play a role in managing rejection. New vessels, lymphatics extend into the cornea. Upregulation of wedge factors. DALK is not associated with endothelial rejection. Vascularized cornea is a risk factor. Most severe form of corneal rejection is stromal rejection. Most common form of rejection is endothelial rejection. Yes, it is not. It is most severe as well as most common is endothelial rejection. It is not stromal rejection. So this would have been the answer. So how are you feeling? You know a lot of infections and inflammation. We need to read a lot. Okay, we'll have the scores now. You want water? Washroom? Yeah, go. Yeah, just one bottle. So each team has scored. So that's a good thing. All have scored. Ganesh? Okay, we'll read out the marks for you all. Just read out. Yes.
The scores are Team 1 Prasad with 0, Team 2 Yenepoya 0, Team 3 KMC Mangalore with 10, Team 4 KMC Manipal with 30, Team 5 AJ Institute of Medical Sciences with 15, Team 6 Father Muller Medical College with 25.
Very good. So in quiz we don't say 0, we say not yet to score. Okay, next time. So, so we go to the next round after he comes. This is the first time in the history of quiz. Okay. So we go to round 2, which is more clinical round now. We'll come out of organisms and inflammatory processes, come to a clinical round. I call it twinkle round. This is 2 questions are in one slide itself. And you have 10 points and 10 points. Again, no negative points, so you can try out. There is a case description, okay? So there's a case description at the end of which you have to answer 2 questions based on it. Very simple, easy round. Definitely easier than the first 2 rounds. Okay, are you all ready? So this is part 1, which is ocular. You'll have a second rotation, which is extraocular. Okay, shall we start? Team 1. Are you ready? Okay. So, 40-year-old woman with thyroid eye disease underwent a surgery for squint. She underwent medial rectus resection. 6 months later, she developed this appearance in the sclera. Name the condition and name the type of hypersensitivity reaction involved. Time is up. You want to take it up? Yes, please try. Please try. There's no negative marks, so you can try. Granulomatous. Okay, I don't give it to you. Shall we make a small change and pass the question? Okay. We'll pass it to team 2.
Ma'am, suture granuloma.
No, 3. Okay, this is a very specific I'm looking for. Team 4. Team 5. Yes. It is surgically induced necrotizing scleritis. So, should we really have this round? No, we'll not have. We'll give you prizes, okay? Will not change because scoring will all change. Give prize to him. Sorry for that. Because everything there also will change, so we'll not change anything. Very good. The answer is sins. So I wanted to give a clue. What sin has she caused that she got this condition, but I didn't want to do that. And what is the type of hypersensitivity? Now would you like to take team 1? Yes? Type 4, yes. We'll give them marks. Okay? Although no, it was a guess, but it is type 4 delayed hypersensitivity. They score 5 points. Okay? Now, team 2, are you ready? Ready? Yes. So this is the clinical condition. 25-year-old man presented with oral ulcers. Later he developed genital ulcers and recurrent pain and redness in the eyes with diminished vision. What is the most possible diagnosis? Behçet's disease. Very good. 10 points. And which country shows the highest prevalence?
The Silk Road.
Yes?
The Silk Road.
Silk Route, yeah, but okay, I'll give it to you because it's part of it. Turkey, is it? Okay. So Silk Route will give, so they score full there. Okay, 10 points. Next. Team 3, are you ready? Yes. So the question to you is, a 4-step and later a 5-step approach, treatment approach has been described for pars planitis. Which step is listed before the last step, that is step of pars plana vitrectomy? Which is the third in the original one? Yeah. Which step is it? No, I don't give it to you, but it's open for the others to answer. Cryotherapy is the right answer. Who described this approach? Kaplan. Yes. Okay, so they don't score there. We go to the next team. Team 4, are you ready now for your own question? Yes? Okay. So 22-year-old woman presented with anterior uveitis, vitritis, and an iris nodule at the angle. MAN2 and PCR test for tuberculosis was negative, and CT showed bilateral mediastinal lymphadenopathy. What serum levels are specifically elevated? ACE. Very good. Full marks here. And what is this nodule called? Berlin's nodule. So they score both correctly. Oh, I have to display the answers. I'm forgetting to display the answers. Okay, they get full points for that. Okay, next is team 5. Are you ready? Okay. This is the clinical condition for you. 35-year-old man presented with chronic bilateral diffuse granulomatous panuveitis with no prior ocular history of trauma or surgery. He also developed sensory neural deafness. Name the most probable diagnosis. Loudly in the mic. I'm not going to do lip reading.
VKH.
Perfect answer. Just full name.
Walked Kayanagi-Harada syndrome.
Perfect. What is the typical fundus appearance in this condition? Acute. You get too late. Answer. Yes? Sunset. That's why I said too late means sunset. Okay. Fine. So they score 5 points there. Okay. Next. Are you ready? They are always ready. Team 6. 30-year-old Indian presented with unilateral sudden diminution of vision. B scan suggested vitreous hemorrhage. The other eye revealed inflammatory sheathing of the peripheral retinal veins. Name the condition.
Syphilis.
Syphilis. No, I don't give it to you. I don't give it to you. She's keen on answering. Anybody? SLE, no. Okay, I'll pass it on. Eales disease is the right answer. I'll give the second question to you. What is the most common systemic association in India? Tuberculosis. So you get half the points. They get half the points there. Okay. So that we end with the second round. But we have some questions for the audience. Our audience is super excited. Yeah, that's good. Double prize, big prize, Seth, big prize. So 30-year-old man developed interstitial keratitis and 3 months later developed tinnitus, vertigo and hearing loss. Investigations ruled out any infectious etiology. Name the syndrome. Name the syndrome. Hogan syndrome. Very good, very good. Very good, yeah. Which term is used to describe the interstitial keratitis in the definition of original Hogan's definition? No. No. What type of interstitial keratitis is described in the definition? It says non-syphilitic interstitial keratitis. It's essential for the diagnosis, for the definition. So very good. We have even audience winning prizes. Maybe they'll take the trophy, don't know. Okay, last one. 25-year-old man presented with painless diminution of vision. Lens showed a posterior subcapsular cataract. And during surgery, surgery on side port entry with the paracentesis blade, hyphema was noticed. Name the condition, name the sign. Very good, very good. Saif, you have a lot of work to do. Okay, so that was Fuchs and Amsler's sign. So we come to the end of round. We didn't finish extraocular. Okay, the second part, similar round but extraocular. Okay, maybe this is a little tough. So we start with team 6 now. Ready? Okay. 40-year-old man was evaluated for weight loss, tremors and palpitations. He has got palpitations. He also complained of bilateral prominence and redness of eyes. What is the most probable diagnosis? Mike, please. Thyroid eye disease is the right answer. And the second part is name the most common modifiable risk factor. Smoking, very good. Smoking is not very good. The answer is very good. So full marks to them. Okay. Next, team 5. Are you ready? Okay. 8-year-old child weighing 14 kilos was referred to ophthalmology for evaluation of red eye. The child also had tested positive tuberculin test. Name this conjunctival condition. Yes?
Nodular episcleritis.
No, I don't give it to you. Okay, anybody wants to try? Flictenular conjunctivitis. Okay, it is flicten. You can see the flicten and the congestion around it. Okay, question again to them. Which is the most common organism associated with this condition, not in India, but in developed countries? Read the answer well. Yeah, please. No, wait. Do you want to take it? Yes. Very good, man. You come and join us, 17 here. Okay, so it is flicten and it is Staph aureus in the west. It is not tuberculosis. So with that, we go to the next team. Team 4, are you ready? Yes. All of you cheer for, because they have not lost a single point so far. We'll see what happens now. Okay. So a 40-year-old man presented with sudden unilateral proptosis with limitation of ocular movements. CT orbit suggested diffuse inflammatory changes in the extraocular muscles and the lacrimal gland. Systemic evaluation and all tests were normal. What is the most likely condition?
Orbital myositis.
Lacrimal gland also is affected. No, can't give it to you. You want to try again, but for no marks. Huh? No. Tolosa, no. Perinod, no. Idiopathic inflammatory orbital tumor. So they do miss. I think meri nazar lag gayi. So they don't score for the first. Let's see what is the drug of choice.
Steroids.
Steroids is the right answer. So they do miss the first question, but anyway, we'll give a big round of applause to them. So they score 5. Okay. So next question goes to, are you ready? Okay. This condition causes unilateral painful ophthalmoplegia and is mostly idiopathic in nature. The diagnostic criteria for this condition are described by International Classification of Headache Disorder, ICHD. What is this condition? Also refer to the, okay, no, I can't give clues here. Time is up. Can we have the answer quickly? No? Anybody wants to try? Migraine? Look at the CT, it's pointing out at something. No? No. You were answering that for the previous question. Tolosa-Hung syndrome. Again, to the same team, what is the drug of choice? Steroid is the right answer. So they get 5 points there. Okay. So that became an easy question. So team 1, are you ready? Okay. 30-year-old woman presented with bilateral chronic irritation and redness of eyes for 6 months. The lesion was positive for fluorescein, lissamine as well as rose bengal staining. She has been on treatment for autoimmune thyroiditis. What is the condition? What is the condition? Yes? Sorry? Loudly please. Keratoconjunctivitis. It's a very specific condition, so I would like a very specific answer. Okay, we'll ask the others. Any other team members? No? Yes, you're saying it. Superior limbic keratoconjunctivitis. We'll go back to them. What is this condition is named after whom? No. Anybody else? Theodore. Theodore. Thygessens is punctate keratopathy. So let's see the answers also. It is superior limbic keratoconjunctivitis or conjunctivitis and Theodore. Okay, so we come to the end of this round, rotations. We have an extra question for the audience. A 10-year-old boy presented with bilateral marked optic neuritis with severe visual loss, and there was rapid recovery after treatment. MRI showed extensive optic nerve enhancement and no evidence of multiple sclerosis. Name the specific. Anupama is on phone, otherwise she would have answered. Yes. No? No, it's not that. It's a very specific to the optic nerve. An antigen which is very specific. Okay, it starts with M. Anupama missed the question. MOG. What is MOG?
Myelin oligodendrocyte.
Very good. Very good. So MOG type of optic neuropathy. And name the cells which are typically preserved. Astrocytes are typical. So that's helpful in differentiating the different autoimmune optic neuritis. So that's why it was an audience question. Scores please. Yeah. Which one? Oh, the next round. Next round is plus or minus 5? No. Minus 1. Okay, can we have the scores? Tough or easy?
It's a mix of both.
Full marks to you. Tough or easy?
To my score?
Till we get the score. Okay. Tough or easy? Easy for the others, tough for us. Easy or tough? By the way, we got the scores.
The scores are Team 1 Prasad with 5, Team 2 Yenepoya with 15, Team 3 KMC Mangalore with 20, Team 4 KMC Manipal with 45, Team 5 AJ Institute of Medical Sciences with 20, and Team 6 Father Mullers with 40.
Okay, so we'll go ahead with the next round. So this is a buzzer round. We have already tested the buzzers, checked the buzzers. So here we want to call it Quicksilver round, okay? Because there's a mix of questions here. There are very easy questions. There are a bit tough questions. Some carry 5 points, some carry 15 points, and some of them carry 10 points. Okay? You have to hit the buzzer, but you should also know that it is either plus 5 or minus 5 it is wrong, plus 10 or minus 10 if it is wrong, and plus 15 or minus 15. So it's going to test both your speed as well as the real confidence that you have in your own answers. Okay? It's easy as well as tough. Okay? Shall we start? Buzzer ready, Diya? Okay. So we start with the first. So at the right upper corner, marks are written. So you will know whether it is 5 marks, 10 marks or 15 marks. And depending on that, you can take the risk. Okay? All of you? So just because you are all are participating, we will add 50 marks to everyone, equal, so that there is no negative. Just add 50 to all. Just insert one at the end, somewhere you add here, the last but one. so that there's no negative and there's no fear of going to the negative. 50 marks added to all. Okay, so everyone gets elevated by 50 marks. Now you can play safely, okay? Don't worry about negative marks. Add one row and add 50, 52. It adds up, not in the end. You should add it here now. Okay, we'll do that. Okay, chalo. Shall we start now? Hands on the buzzer. We are starting with a very simple question which was asked in the UG quiz. So we have to answer it. Let's start. Shall I? Okay. Who takes it? Team 4.
Hutchinson sign.
Yes, Hutchinson sign is the correct answer. So team 4 gets 5 points. Okay? Okay. Ready? Tell us when you are ready. Ready, no? Okay. Next question. Okay, answer is coming, sorry. Okay. Spot the etiological diagnosis. Team 6. Etiological diagnosis. TB. Tuberculosis. Yes, correct answer. Team 6 gets 15 points. Yes. Yes. Question 2. Team 6, 15 points. Okay. Are you all ready? Next. Ayo. Spot the diagnosis. Team 3.
Molluscum contagion.
Very good. Plus 10 to team 3. Okay. Very good. Wait, these answers have to come now. I should not have put the answers here. Okay. Next. Are you ready? Hands on the buzzer. Team 6. Team 6, go for it. It is plus 5 or minus 5. If you don't answer also, minus 5. No, you're taking too long. No, they get minus 5. Minus 5. What is the correct answer? Kopes nodules. Okay. You didn't say for a long time, then I heard one basaka there. God promise? Okay. 5 points plus 5 points. Okay. We are giving that 5 points because they are genuinely telling it. Yeah. That's why, no, please speak in the mic so that it is very clear. Okay. Next question. Ayo. Okay. Spot the sign. Team 2.
T sign scleritis.
T sign. Very good. You extra answers, minus points. Sign is T sign. So team 2, 10 points. Next. Okay, 10 more questions. Haba. Team 3.
PUK.
PUK. More specific answer I wanted. Yeah, I'll give it to you. I'll give it to you. Team 3 gets 5 points.
Excuse me.
Team, sorry, we are on this. Spot the diagnosis, keratitis. Nobody wants to take it? Team 2. Yes, marginal keratitis. So team 2 gets 15 points. You wanted to say something. Buzzer? Okay, it's working. Okay, so the next question. Your 15, team 4. Team 4.
Do we have to be specific which ulcer?
Yeah, which ulcer is
Mycotic.
Yes, got it. Correct. 15 points to team 4. 15 points to team 4. Okay, next question.
Festoon pupil.
Team 6. Festoon pupil. Okay, if you answer before, it's your problem. They get 5 points. Okay. So ready? Wait. Okay. 4. Team 4.
Demodex.
Very good. Full name?
Demodex follicularum.
Very good. Plus 10 points. Next. Where is it? Okay, 6.
Mucocele.
Mucocele. I want more specific question because
Acute diagnosis.
what should I do now? Second time I can't give them. No, will not give it to you. -5. What's the correct answer? Acute diachrosticitis. Will mucocele have this redness? No. Then will you go ahead and do syringing? No. Then, so they get -5 now. Okay. Next question. Team 4. Team 4. Which itis is it? That's the diagnosis. Don't say ptosis.
External audio.
No?
Can it be?
No, they get -10. Team 4 gets -10.
Dacroadenitis.
Yes, it is dacroadenitis. But you corrected it. Don't make me do again and again.
Okay.
Kya kare? First is wrong, so they get -10. Okay, -10. Thank you. Yes, we did that for them also. So next. So minus you are putting, no? Okay. Otherwise it will add up. Okay. So next question. Okay, 3 more. Last 3. Etiological diagnosis. What is the etiology in this condition? Team 2.
Neurocystic sarcosis.
No. -15. -15. What is the condition? What is the condition? Clinically, what is it? What is it? It is cataract, no? What is that? Necrotic cataract. Which condition gives rise to a necrotic cataract? Rubella. So that's why it is -15 to team 2. Okay? Okay, that's why it was 15 marks. That's why it was 15 marks. Spot the diagnosis. Team 3.
Brush fair appearance, CMV.
CMV retinitis is the correct answer. They get +10. Next, I think the last question is here. Spot the diagnosis. I want a correct, clean, nice answer. It is for 15 marks. You can see the CT scan. There's an arrow there which is pointing out. Anybody wants to take the risk? +15 or -15? You really want to take 15 or -15? Take it. That's the spirit. Okay, nobody wants to take it, but you can answer just like that to see whether you are right.
Supraorbital blowout fracture.
Fracture. So what will happen? What is that spicule that is seen? Which itis can be caused by this spicule? This bony spicule. Where does it hurt?
On the
Which structure is there? Optic canal.
yeah, then optic nerve. Optic neuritis.
Yes, it is traumatic optic neuropathy caused by a bony spicule, because now everybody is doing like this. Okay, that's the last question. So let's have the scores. Before that, by the time they are ready with the scores, I'll tell you something about the next round. The next round is the speciality of this quiz. That's called the Wordle round. Have you played Wordle? You said no. Okay, there's a game called Wordle. Okay, they are all interested in that. Let's see the scores first.
The scores are Team 1 Prasad with 55, Team 2 Yenepoya with 75,
Okay.
Team 3 KMC Mangalore with 95, Team 4 KMC Manipal 115, Team 5 AJ with 70, and Team 6 Father Mullers with 110.
Wow, that's a good score. Everyone is scoring well. Some are scoring better than the others. There's a very big, not big, very small difference in the leading teams. So let's see how they catch up, and let's see how the others also catch up in the next 2 rounds. So shall we start? Okay? Okay. Want water? Anybody wants to go to the washroom? So when you, have you played games in the Deccan Herald and Times where you need to fill up the alphabets to make the word? It's something like that. Okay. So this is called Wordle round, Wordle worm, okay, whatever it is. So you have a lot of time, 2 minutes, okay, for each. So you have to identify 3 words Nothing is given to you, no clue, no image, nothing is given, no question, nothing. You just use your intelligence and try to identify these words by selecting alphabets. As you select alphabets, I will click on that and the alphabets will appear there. So what is your name? Lakshmi, Laxmi. So if you, correct, yes. So if somebody says A, then I'll click on A and the A will appear there. Okay, then somebody says I click on I will appear. So you have now a word with second letter. The idea is before the time is over, you have to get those 3 words. And the 3 words are connected to one condition. You have to identify that. Okay, let's play a demo. I want everybody's support for this round, okay? I'm trying something new this time. So let's start this question, the 3 questions which are coming up. It's coming like this. Okay, this is the layout. There are the 3 words which are here. See, can you see this? The first, there's no cursor, okay. These are the 3 words. You can also see there's a hyphen. Understand that it's a double word. It's a compound word. These are the 3 words. The first demo round has got something to do with our lives as postgraduate students. Okay? So with that clue, we will start. You can all choose. What is the first letter that you would like to? A. Okay, they want A. Let's see if A is there. Yes. A is there in many places. I is what they want. Yes. Anybody else from that side? S. She says S. Good going. Don't. M. Next. Somebody said T. Let's try T. Are you getting any orientation to what these words will be? The first one. O-N. Okay. O and N she wants. O. And then she also wants N. So that's completing a part of the word. What is that last word? So you know it is examination. So you don't have to try E and X. Don't waste your chances. You know that the third word is examination. What is it that you want to try in the first letter? First to confirm. What is this ISS? Don't say kiss, miss and all that. There's nothing like that in your PG life. What? Yes. So what is that word? D. D you want to try? Okay. So what's the first word? Dissertation. Last word? Examination. What is the second then? Paper poster. Okay. Okay, this is all about our PG life. Now, what is this? All 3 are linked to something. Okay, what is that it is linked with? Eligibility or PG life. I have just meant PG life. Okay. So this is how it will go. But the other teams are not going to help you. You have to help yourself now. Okay. Each team will help themselves. So you can, shall we start? Ready? Okay. Yes. Okay. For every word, like for dissertation, you get 10 points. You said paper poster, so you get 10 points. Examination, you get 10 points. So 30 points there. If you find out what is the exact word here, you get another 20 points.
How many times can we ask for?
And in the end, after you have guessed all the words, we'll try to find out how many letters are remaining there. That is your bonus points. You have to remind me for the bonus points. Okay, now how many alphabets are remaining there? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18 points you get as bonus points if you leave them on the screen. You got it? Okay, all of you. But see, the timer will be there. The slide will change automatically after 2 minutes. Okay, you have to finish within that. Done? Okay, hope. Wish me good luck.
Will they all be related to one topic?
Yes, all 3 will be related to one topic. For example, traumatic optic neuropathy is the word. It will say fracture, it will say optic nerve, whatever, something related, and RAPD, something like that. All 3 words will be related to traumatic optic neuropathy. Okay? Ready? Everything is related to some form of infection or inflammation related to ophthalmology. Right from eyelids to nerves to brain. Okay? Chalo. So who is the first Bakra? Let's see. This will start with team A1. Team 1. Okay? So, okay, sorry. This is your. You have to tell me the alphabets in the mic.
I.
Okay. Why is the cursor? Sorry, I'll give you 2 minutes, 2 seconds. Cursor for 5. I need the cursor. Wait, you close your eyes. Wait, we'll just disconnect once. Okay, now it is working. Sorry. Madi, help Madi Krishna. But you got more time, you should be happy for that. Okay, so it's exactly 2 minutes, after which I am just checking whether it will work again or not. Okay, time is there, 2 minutes. Timer, no, it's there in the slide. Okay, start. I, you said, no? Okay, I is here. Yes. S. A. T. You're seeing some itis there already. You have to be faster. O. No. M. Fast, please, so that you don't waste time. C. C is a good choice. The red letters are all vowels.
V.
What it is?
Vasculitis.
Yes, yes, vasculitis is the first. They get already 10 points.
Sarcoidosis.
Okay, sarcoidosis is the second guess. Then sarcoidosis doesn't fit there. Go on trying, please. D, okay. Please use the mic.
N.
M for?
N.
N, okay. H. H is a good choice. Go for it. You don't want bonus. You can use all.
L.
L.
U.
U. Oh, your time is up. So we'll still go ahead with it. I think we can try. Yeah, continue. We'll continue. Fast, fast, fast.
R.
R. Your
F.
F. Okay, we'll stop. Any guesses there? Very good. So the answers, they have given all the answers. Vasculitis, serpiginous, flictin, and the final answer is tuberculosis. Superb, man, superb. Give them something, yeah. Whose is this? This is for the principal. Okay. Okay. So the answer is tuberculosis. Very good. Okay. Next team, team 2. Are you all ready? Okay. This is your. Go on telling. A. I. T. O. K. Okay, I heard. Use the mic, please. S. R. Okay, vitrectomy. Okay, go ahead. M. N. P.
Yes, ma'am. P.
Okay. H. Okay, H you said. Hypopion, vitrectomy. Fast, fast, your time will be. V. Okay. E. Okay.
Exogenous vitrectomy hypopion.
Huh. So what is the answer? Endophthalmitis. Very good. They get. Oh, thank God. So very good, very good. So the answer is endophthalmitis. Huh? Okay, bonus. Let's see. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 points. Bonus. That's very good. Okay, team 3 for you. Okay. Let's start.
I.
Oh, you have to be fast.
IT.
I.
T.
T. Wait. Sometimes it is mad, yeah. Wait. Okay, I'll use the mouse only. Okay, they said
I. T.
Wait, I'll have to start the timer because we lost some time. I will take your I and T immediately. Okay.
I. T.
T.
S.
S.
A.
A.
O.
O.
E.
E. I can see the answer.
P.
P.
Pseudodendrite.
Okay.
R.
R.
Peri.
Go ahead.
See what you did. See here. Oh, perios.
Fast. Time will get over fast.
D.
D. Oh, I have to see here. Okay.
10 seconds.
Yeah, something is wrong with the mouse also now.
D.
Nange help ಮಾಡಿ.
Can we answer the last one?
Yes.
Simplex. Herpes simplex. Sorry, what is it?
This mouse is going mad. We'll give that whatever time is required. Now it's working. You said D, right?
D. Yeah.
Yes.
M.
You have to be faster. I'm giving you 10-15 seconds more.
C.
C. Okay.
It's not come anywhere. N.
N.
Perineuritis.
Okay.
The last one. Simina.
You said for pseudodendrite, right?
Pseudodendrite, yeah.
Then third one was? You want to have a look at it? What is that? Can you connect the three? You have that extra 10 seconds.
Pseudodendrite.
almost seen there. Keep on. Okay, so what is the? Everyone is telling except you. Everyone is acting also. Okay, so they get 20 points. Do you want to collect the 2 and guess the third one? Click on who am I? Click on who am I? Yes. Yeah. So you get 20 points, okay, for getting that on time. They get 20 points. So that what is the third one? Bonus we'll give. Okay, we'll give or no? Not give, no bonus. Okay. Next. So that's okay. Okay, so we go to the next. You want the chair? Okay, team 4. Are you ready? Team 4 is ready. Okay. I.
O.
O.
T. A. E.
E.
S.
S. Okay. No. Fast, you lose time. Make it fast.
C.
C. M.
M.
Come on.
Guess.
Mebomian.
Mebomian. Next is? Go for more letters. Don't worry
F.
about bonus. F.
U.
U. Okay.
V.
V.
R. Curettage.
R. Okay.
Triamcinolone, mebomian, curettage.
So what is the connecting condition? Chelazion. Very good. Wait, bonus. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 points bonus. Very good. You are almost giving it up there. Okay, we go to the next. That is team 5. Team 5, are you ready? Okay. Yes. I. M. Okay, she wants to give the first word. Okay, actinomyces. Now, others. Go ahead. N. Go ahead. You lose time. L. H. D. Dacrylid. Second word. You've got 2. R. E. No, didn't help. Go ahead. Fast, you'll lose your time. P. Now you got lots. U.
Answer in the mic.
Yes. You almost got all the 3 words. G. Hey, time is up, but you still have the option of. Yes. What are the 3 words? They're almost there on the. Got it right. Actinomyces, dacrylid, which is the second one. Pouting punctum. So, which is the condition we are talking about? What condition causes are related to this? Okay. Who am I? Click on who am I. Yes? No, they will still get the points. Who am I? Whole answer is there. You get 10 points for that. So they get 40 points, not 50 points. Because they got all the 3 and the answer after clicking on this, no? So it was all open. Bonus we didn't count. Bonus.
Didn't get the answer
Pouting. Pouting punctum they told. You told no pouting punctum.
Pouting punctum.
That they told. They didn't tell the answer. Actually, they get 30 points.
30 points.
Yes.
Correct. No bonus.
No bonus.
Next.
Yes, correct. Next. The last team, that is team 6. You want to stop? Team 6. Are you ready? Yes.
I. A.
A.
O.
O.
T.
T. O.
S.
S.
M.
M.
E.
E.
C.
C.
Scolex.
Scolex is yes.
Acanthamoeba.
Take chance. Take more chances.
M.
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 M is done. You want N now. What do you want? N. It's there. Huh?
Y.
Y. Fast. You can guess later. Just ask for more. Huh? K.
B.
V. B. Okay. It's clear.
Albendazole.
Scolex.
And R.
R. Sometimes you become blind.
U.
U.
Albendazole, subretinal cyst,
Huh.
Scolex.
So which is the condition? Time up. Tell quickly. On the dot. Because 20 points you will get, otherwise you will get only 30 points. Okay, no, they don't get it. Anybody else? Cysticercosis. Okay, so that was the last question in that round. Yeah, 30 points. So no bonus. So we don't have that because, yeah, this is audience like, no, it's okay, we'll leave it. We'll not have it. Okay. So we have scores at the end. Did you like the round? Okay, I'll try something new here. Can we have the scores?
Team 1 Prasad 65, Team 2 Yenepoya 138, Team 3 KMC Mangalore 115, Team 4 KMC Manipal 179, Team 5 AJ 100 and Team 6 Father Mullas with 140.
Excellent. So we go ahead to the last round now, and that's buzzer round. Plus 10, minus 5. Okay. So you just have to hit the buzzer and claim your points. Look at the difference. KMC Manipal is going to sleep now, I think. Okay. Are we ready? Okay. Minus 5. Have I written minus 10? No, minus 5, please. Yes. Okay. Plus 10 or minus 5. Okay. So we have 20 questions here. Are you all ready? Audience, please prompt. No, please don't prompt because it's going to make a lot of difference to their points there. Okay. Shall we start? Hands on the buzzer. Right. Start. First question. In CMV endotheliitis, okay, team 3.
Owl.
Owl is a very right answer. Here. No, I think this only. This. Yes. Yes, yes. Click on answer once again. Yes. Okay, it's clicking on the answer. Okay, that was first. Second question. The organism most often present in HIV microangiopathy lesions.
Pneumocystis jirovich. Pneumocystis.
Look at the question. -5. Which is the organism? No organism. Okay. There's no organism in those cotton wool spots. So they get -5. Okay. So next question. The classic tetrad of cardinal signs of inflammation was described by team 5. Loudly, clearly.
Virtue.
Yes. Okay. That's the pronunciation was a little different, but you can click on it. No, Celsius. Virtuous. Confused me also. -5 for team 5. Okay, so we go to the next question. What is this triad called? Look at that. Yes, team 4.
Hutchinson's triad.
Yes, Hutchinson's triad is the correct answer. Okay, next question. Candy floss appearance in the cornea is seen in which condition? Huh? Silence. Nobody's taking up? Anybody there? All answers are coming from there. Now, what happened? Okay. So, anybody else? Candy floss appearance? Okay. So, let's have the answer. I also seem to have forgotten there. Okay. Next question. Who gave this classification of scleritis? Hi Rama. So difficult. No? Nobody is taking up? Can we have the answers? Anybody? Watson and Hyre. I said hi Rama. Nobody took the clue. Okay. Next question. Okay. Oh, next question, please. We'll skip that question. Identify the most likely organism causing the condition illustrated in this picture. Nobody is going for it. Yes, team 3.
Granulomatous uveitis.
But it's not an organism.
TB most commonly.
No. -5. Can we have the answers? Because the KPs are different. The hemorrhagic, this is also there. So it's more likely to be CMV uveitis. Yeah, this is a picture which gives a nice classical. No, CMV is not stellate. CMV is not stellate. CMV stellate KPs are seen in Fuchs. Okay. Next. In which severely painful keratitis are prominent linear hazy lines seen in the periphery of the cornea? Severely painful keratitis. Team 4.
Acanthamoeba.
Yes, acanthamoeba. And the answer, what are those lines? What are those lines? You had that question in perineuritis. Yes. +10 to them. Next. Which ocular infection has been known from the Ice Age days and is seen even today? Try. Uma is saying try.
Conjunctivitis.
Trachoma. Trachoma is the condition which was described even in Ice Age. So, okay. Okay, the last 10 questions are done. Okay, next question. Yeah, we missed one question. Yes. Finger-like, yes, what is the answer? Team 6, yes. Dawson's fingers is the correct answer. Yes, correct. Perfect. I did not know this actually. Okay, next question. What is being calculated here? titer of antibody in the aqueous divided by titer of antibody in the serum multiplied by concentration of team 2. What titer? What is the name of the titer? No. No. I don't give it. -5 to team 2. Anybody? Goldman? Yes. Yes, Goldman-Whitmer coefficient. No, gone. Saif, help him, no? Okay. In which structure of the eye are Russell bodies seen in Fuchs heterochromic iris? Iris. Straightforward answer. Very good. 10 points to team 3. Okay. Next. Name the microfilaria making it to the list of common blinding conditions.
Loesis.
-5 to team 4. Microfilaria. Loa. This one is Loa. Okay. So -5 to them. Next question, please. This culture medium is used to grow which group of organisms? Team 4.
Anaerobic.
Very good. What is that medium?
RCM.
RCM. Okay. Next. +10. Okay. Next. Depressed areas. Where is team 6? Depressed areas are left behind by large follicles. No, it is not VKH. Anybody wants -5 to team 6? Yes, what is the trachoma only? Yes, trachoma. So they get -5. They are Herbert Spitz and it's seen in trachoma. Okay. This inflammatory condition in the macula is characterized by cockade-like lesions, stippled appearance surrounded by depigmented halo. Name the condition. If you don't answer, your retina specialist will kill you. They will really kill you. Time's up. Krill disease, okay, not kill disease. Okay. Okay, last 3 questions. Give it your best. This German obstetrician and gynecologist described the prevention method of which ocular condition? Adu avaru nodalla.
Ma'am, Creeds.
Team 4, Creeds is the right answer. But no. What is the condition?
Ophthalmia
neutrum. Okay. Very good. Because Creed is written there under his name, under his photograph. Okay, the last 2 questions now. Second last. Which condition made him bilaterally blind?
Retinitis. RP, retinitis pigmentosa.
Wrong answer. Who is he? See, we are talking about itis. Retinitis pigmentosa is not a true itis. Wrong answer. Who is he? Braille. Yeah. And what did he suffer from? Sympathetic ophthalmitis. So they get -5. This is the last question. All of you, try your best. It's a long question. I'm going to read something now. A story. In 1993, Hope Ross was treating a 65-year-old patient with choroidal melanoma. The plan was to enucleate the eye. Meanwhile, Ross was also interested in knowing pathological changes in a condition called X. So he induced this condition X in the patient by exposing him to the causative factor before doing enucleation. So 6 days before doing enucleation, he exposed this patient to that causative agent, induced that condition, and after enucleation was done, he used the histopathology technique to identify the changes caused by this condition. Any light falling into your head? Time is up, but you can still try. Anybody? For no marks now, you can try. So before doing enucleation, 6 days before doing enucleation, he asked the patient to sun gaze. Expose his eye to excessive amount of sunlight And then that caused solar retinopathy, which he was interested in understanding. Then he did a histopathological examination and found out the changes seen in solar retinopathy. So something that we need to know, maybe. That's it. So if we have time, we have these 3 questions. Otherwise, no. So that was the last question. Yeah, can we have the scores?
Team 1, Prasad with 65. Team 2, Yenepoya with 133. Team 3, KMC Mangalore with 120. Team 4, KMC Manipal 214. Team 5, AJ 95. And Team 6, Father Mullers with 145.
Wonderful, wonderful presentation by everybody. All have done very well. Some have exceptionally well. That's why they'll take away the trophy today. And yeah, I hand over to Sheetal. So we don't have tiebreaker questions.
So thank you, Dr. Uma. That was a wonderful quiz. I request our Vice Principal, Dr. Prakash R.M. Saldana, to come over to the stage. So this year is special because it's the 25th year of Yenepoya Medical College. So, and it's also the 16th year of our PG quiz. And this beautiful trophy was designed by Uma years ago. And she has also sponsored it in the name of her parents. So we would like to, actually they couldn't come here because there was some issue with the road problem. Otherwise they would have definitely been with us here. They were here with us last year. So we would just like to send a token of our appreciation and gratitude. Please take it for them. I request sir to hand this over to Dr. Uma. There's another small surprise from the department for her. So since so many years, the quiz is going on very nicely. So it is her commitment towards the quiz. Though there have been so many others with her, but I think she's the driving force. And we would like to recognize that with a small token of appreciation, being the 25th year. So again, I request sir, please. I think you should give this to us. I'll be with you. No, I'll be with you, sir. Please. So thank you so much for the infectious spirit. Every year for the quiz, there's a special round. Like this year, it was Wordle. So somehow she manages to keep the interest and enthusiasm. And this is for this year's quiz. Thank you, sir. Now we will announce the... I request Dr. Tanvi to come over to the stage. Dr. Tanvi? She's not here? Okay. So Dr. Tanvi was the UG quiz master. We wanted to hand over the certificate to her. Maybe she'll be back. Yes. So now for the prize. Okay. Where's the quiz master? Quiz master, please come over. We are going to hand over the prizes. Yes.
First place, KMC Manipal.
Yeah.
Second place.
So we'll hand over this. So the winner of this year, the 16th Intercollegiate PG quiz competition held at Yenepoya Medical College during its Silver Jubilee celebration goes to KMC Manipal. They are not parting with the trophy yet. So congratulations for the wonderful performance. The second place goes to Father Mullah's Medical College. Please give them a big hand. And the third place goes to our very own team, Yenepoya Medical College. Please come over. We are glad at least we have one prize. Congratulations. Tanvi is here. We request our young dynamic quiz master of the undergraduate quiz to receive her certificate. So,
good afternoon to all of you. First, I want to congratulate the winning team, KMC Manipal, followed by, I think all of you have done very well looking at the score. And I also congratulate the Department of Ophthalmology for conducting this quiz in such a good manner. And especially the quiz masters, Uma and Tanvi. Yeah. Okay, yeah. Thank you very much. Yeah.
thank you so much, sir, for being with us. Thank you. Yes. So we come to the end of this session. Anybody wanting to say anything? Can we have a group photo? But before that, let me thank everybody before another group photo with all the participants and the quiz winners. So we are always happy that we have very good participation. Somehow one or two teams got missed this time. But we would like it if you could get more of your friends along, because it's such a nice learning also, right? A lot of effort goes into organizing this and making the quiz. So next time, at least get a couple of friends along. Thank you all very much, especially the team from Manipal. Then we had staff from Kanachur. And in case I've missed somebody, thank you all for being here for this quiz competition and making it a success. Thanks to the supporting team, the ones who are keeping the score, the audio-visual, Mr. Jagdish for buzzers, the volunteers, the quiz masters, and if I'm missing somebody, thank you very much for being a part of this entire organizing team. Thank you very much. I think we all need to assemble for a photograph. Please do come on stage with your trophy, with your certificate. And a small announcement, the cash prizes will be sent to your bank account. So please make sure your details are given. Okay, there will be a volunteer for it, and it will be transferred. In case of any doubt, to us immediately. Give us about a week's time. In case you don't get, please contact us and we'll see that it reaches you. Okay? Thank you.